We are sailing very close to the wind, a gust of wind in the wrong direction, and we're in real trouble. They are the words of Professor Philip Nolan, chair of NPHET, the modelling advisory group of NPHET. Philip Nolan joins us now. Philip, why did you use those words?
Good morning.
Morning.
I think, first of all, I want to emphasise the fact that we have made enormous progress. We've gone from 6,500 cases a day to 500 cases a day, from an extraordinary number, 2,000 people in hospital with COVID-19 to 360.
Yeah.
But I think we're in danger of forgetting that that level of disease is twice what we saw in December. It's 50 times what we had as we entered the summer last year in June. We have the same number of people in hospital now as we did at the peak in October. And we've almost twice as many people in intensive care as we had at the peak in October.
Yeah.
So we've done exceptional work, but because of that level of disease and because of the fact that we're now working with this B117 more transmissible variant, we're in a very precarious position.
Okay.
Up to now, we've had the disease suppressed, but only just about.
Can we tease that out a little bit? Because I look, the figures for yesterday and the day before were disappointing. I did hear George Lee on Wednesday going through the numbers, and he was saying that the weekly figures, he said, look, the daily figures you'll see fluctuation, but he was making the point on Wednesday that the weekly figures, the week-on-week figures, were down 20% week-on-week. And I kind of thought, oh, well, that's good news. But you seem a little more concerned. Do you think we've stalled a little bit?
It's a rapidly evolving situation, and
Sure.
You're absolutely right. Up until as recently as Monday, we were looking at a slow but steady progressive suppression of the disease because of the work that we were all doing, the really difficult work of staying apart. It's just in the last few days, and frankly, we're worried. It's only in the last week that we've taken the first step in getting back to some of our key priorities, the education of our children, the return of elective care in hospitals. And we were worried as we started that we might see increased social mixing, increased return to the workplace on the margins of that cautious reopening.
Yeah.
And I'm concerned that we are seeing that. So put the two things together, a few days of unusually high case counts compared with preceding weeks, the fact that we can see more social mixing and mobility in society. It's a responsibility right now to sound a warning to the public that we have done so well. Let's not waste that progress over the next few weeks.
Philip, I'm anticipating the text. People will text in and say, "Oh, this is the schools. The schools are back. We warned you. The schools shouldn't be back." What would your response be to that?
Well, there's simply no evidence that that's the case, and there's two reasons for that. First of all, we have the evidence of history. We had a global reopening of our schools last September, and it had no impact on the progression of the disease. This is a much slower and more cautious reopening. The second thing is, even though it's early days, we've seen no particular change in the transmission of the disease in young people. And we also know that our public health colleagues are exceptionally careful around any incidents in schools. They investigate them very thoroughly. We only have 6 very small outbreaks declared in the last week, fewer than 10 cases linked to them at the moment.
Okay, all right.
But there remains no evidence that schools are a driver.